I just came in for a screening and they actually ended up finding a spot in one of my breasts.
For our patients, if they have to drive pretty far away, they're looking at about a 45 to an hour drive going up to Iowa City, or you're looking at going to Des Moines, and that's 3-4 hours. The hospital itself is out to provide services to the small rural community, not making patients drive as far as they need to and keeping them close. We're able to also have control with the patients and getting them back in quicker versus making them wait so long to come back for follow-up.
They said they got a new machine here and they needed some test people to test out the new machine. Wanted to know if they had any volunteers, so I called my physician here at the hospital and asked him if he would be willing to order me my screening mammogram.
As we were getting through and using our other machine, we were just having some technical difficulties starting to go on. Just like any regular technology, they start to age, and we were seeing all the improvements with the digital technology and wanted to go forward with a better opportunity of better image quality and comfort for patients. So when we started looking for new machines, we were looking at how the images look, the wider angles of the machines to see if we can offer more detailed imaging for patients. And then we were also looking at the comfort aspect. Is this going to be a longer compression? Is this going to be a more drawn out experience? Or are we looking at a shorter time and more comfortable for the patient?
So I came in, it was a great experience. The technologist did a great job. The machine was amazing. I didn't feel anything at all. They called me immediately. I was back in here within 2 days to do a follow-up diagnostic mammogram with the breast ultrasound to follow. And as of I know, everything seems to be okay. But without the new technology and without the new machine, I'm not sure if it was something that would have been found. They pulled me aside, they showed me the spot, showed me exactly what they were looking at, which was really nice to see. Gave me a great sense of peace when I was in here.
So with the shorter times, we are seeing the same image quality. The patient is not in that compression as nearly as long as some of our other options. We're able to get patients in and out within about 15 seconds and not having them be uncomfortable that entire time.
I really didn't feel anything. You hear the horror stories of everybody telling you, like, be careful with the mammo, you know, it's terrifying and it hurts so bad. It didn't hurt at all. It literally did not hurt at all. So it was really important to me once I hit 40 to come in and get my screening mammogram, because if there were anything, the earlier you can find it, the better. We do have a family history in my family of breast cancer, so it's even more important to get that early detection.
Browns did help with the selection of the machine. They do make custom solutions for us. They were able to walk us through what our service contract would kind of look like, how we'd be able to get a hold of them. They also have the opportunity to essentially like iLink into our machine and can see things virtually before having to come on site as well to help diagnose things. They're pretty flexible and easy to work with, and then they're reliable on getting in here for us.